First of all, thank you all for the panel for being here. I think this is an extraordinarily important discussion to have, especially with the increase in autism, as we saw in the film, from a prevalence of 1 in 2,500 to 1 in 31 today. I knew it was increasing dramatically, but I found that statistic stunning. And I know there are so many questions about what is causing it, how can we best treat it, and I will say that this film was an eye opener for me. And it was an eye opener for me because it made me question what I thought I knew about the diagnosis and the path to a diagnosis and what can be done. So, Wilder, let's start with you. How did you get interested in the subject and talk a little bit about the challenges of addressing it?
Yeah, sure. Well, first, thank you for hosting, and it's so good to be here with everyone. Um, so, to begin, well, I've been making films about nature-based education and outdoor learning and education that has less technology or less screen time, and so that's kind of always been an interest or kind of theme I've found in the films I've made in the past. And then a family relative, Sean here, shared some of the research that he was doing around screen time and autism, and I read the studies, and I was amazed that more people that we weren't talking about this more, and and then after the first couple interviews, one of the researchers from France was traveling to the United States and talking with her, Dr. Dukanda. It made me realize that this was a worldwide phenomena. We were talking about the digital revolution and how research is just catching up. We're just like beginning to understand all the impacts of technology in our lives, and so I just felt this dedication that we this was one of the first documentaries to help get this word out, and also to just share the like such a positive, hopeful message that so many families have. So that's how kind of the interest began, and then we did many interviews to follow the story. Yeah.
I have one quick question about the development of this story because it was new to me until Marilyn wrote her piece for Mad in America in 2017. And we have here Michael Waldman and Sean Nicholson, your uncle, and they've been doing research from 2006. Your film touches a lot about work done in other countries, France, Romania, etc. But is their work secondary to the research done by Sean and Michael? In other words, did this theme, this worry, this preoccupation come first from their research, and now you have these other programs in other countries, or the interest in expert
Yeah.
in other countries?
What we kind of discovered was that many different research groups from all over the world have independently found these same discoveries, like and same findings, similar findings, and and while they're independent, Michael Waldman and Sean Nicholson, their study from the mid 2000s was the first published study, but then gradually there became more and more studies, um, and and so our progression was to talk and hear from those different researchers. Yeah, right.
Well, you went wide and far to do this documentary.
Okay, can I pipe in just for a second?
Please.
So a lot of those early kind of France, Romania, a lot of those people reached out to me and Sean. And so that's how we were able to kind of create a community.
Oh, that's fantastic. And I don't know of any other documentary on this, Wilder and all. This is like the first real documentary on this subject, isn't it? Or is there a film that's really tried to bring all this forward before?
Right. There have been some short films. There is a short documentary from Romania that Dr. Marius Zamfir produced. However, our production that everyone's helped to bring to the world is the first feature documentary looking at screen time and autism specifically.
Well, I can't tell you how important I think it is for us all to be thinking about this. I'm going to switch to Marilyn here just for a second. Um, Here's what I heard, Marilyn, when we began advertising this. Oh, that's not real autism. Okay. And that's something different. Real autism is, a neurological disorder. It can't be, it can't be treated, et cetera. And there is a moment, it can't be reversed. And there is a moment in the film where they talk about the difference between classical autism and virtual autism. So can you tell us a little bit because this wasn't explored that much, what is classic autism? And also a little bit what we understand about classic autism, what are the causes? And how is it treated?
Right. Well, first, Bob, I'd like to thank you for hosting this and for hosting the film. We appreciate that. So the diagnostic criteria for classic autism and virtual autism are the same. It's impairments in social interaction, impairments in social communication, and restricted or repetitive activities. But of course, there was autism before screens. And I'll just go through a little bit of the history of the treatment. In the 50s and 60s, Bruno Bettelheim came up with a theory, an unfortunate theory, that autism was insufficient mothering. He had this idea of the refrigerator mother. And the treatment was to take children with this diagnosis to be treated in his orthogenic school in Chicago. And so to take them away from the family. Actually, I lived about 4 blocks from his orthogenic school, and he had this big sculpture of a mother in the middle of it that children could climb on. Anyway, that theory was unfortunate because, in my view, that really isn't the cause of classic autism. So in the 60s and 70s, the Milan School in Italy, Mara Salvini Palazzoli and her colleagues had success in treating classic autism with family therapy. And actually this is pretty mainstream because, as I mentioned before, my son in medical school, in his psychiatry rotation, learned that the Milan School had success in treating autism. So of course he came to me with that. And I had been studying the Milan School for several years before that. So the family therapy view, a way of treating autism, is that the symptom of autism serves a function in the family system. For example, an autistic child may draw parents' attention away from severe marital difficulties. And so if you treat the marriage, you have to figure out what the function of the symptom is. Who is the autistic patient helping? I know this sounds a little strange, but this is how we think as family therapists. Who is the symptom helping? And then by getting help to that unit, we can alleviate the symptom. And the Milan School had success in it. Jay Haley and the Family Therapy Institute in Washington had success in it. And I have to say, I have had some successful cases of treating autism with family therapy. If usually when I catch it at 2.5 to 3 years old, it works. And some pediatricians, especially here in California, would like us family refer to us and say we'd like it treated as a behavior problem and a speech delay. So you treat it with speech therapy and basically marital therapy. Then now in the 80s and 90s and thereafter, the psychiatric community adopted the biological model, saying that it was a neurological illness, it couldn't be reversed, and the only way to treat it is to manage the symptoms with medication or ABA, behavioral programs. And ABA has had some success, a lot of success in reducing symptoms. And medications used to treat it are antipsychotics like Abilify and SSRIs, antidepressants, to calm the child down if there are behavior problems. So we have evolved from blaming the mother to looking at the family as a unit to simply drugging the child. I hope that answers the question.
Thanks. One real quick thing. I have a sort of a memory from growing up and of exposés of autistic kids in institutions.
Yeah, like Bell Huns, yeah.
Yeah, like but I mean being left alone in corners, rocking, banging their heads, completely lost to the world.
Yeah.
Where did that image come from?
That image, I think there is a very small percentage of children, and that maybe 0.1%, that perhaps have organic brain damage that could have been diagnosed as autism. Certainly there were developmental delays enough to fit it into the category of autism. Some of those might have been children with a family system problem, and it just wasn't getting resolved, and there was just incredible frustration and anger and acting out. But as you said, there was maybe one in a whole school or one in a whole community. It was very rare.
Which is a segue to the next question, which is so important to this whole movie. I forget when there's a shot that talks about the growth and the prevalence of diagnoses from 1 in 2,500, and I think that goes back to the 60s or maybe very around 1970 to 1 in 31 today. And this is a question specifically directed to Michael and Sean. We do know that one way that has happened since then is that there's been an expansion of the diagnosis, that we went from autism and then we had Asperger's syndrome, and now we've combined those two into the autism spectrum disorder. So when we talk about this increase in prevalence, can you give us any sense of like how much is due to the expanded diagnoses and how much is in fact something in the environment, and this will obviously lead us to the virtual autism, that is in essence triggering these symptoms or leading to brain development in the young child, that they start behaving and having this reaction to the world. So Michael or Sean, can you talk about why are we seeing this extraordinary increase in diagnoses? How much is due to just expanded diagnostics? And how much is something real going on with growing up today in this modern electronic era?
Sean, do you want to start on that?
Sure, I'll start, and then I'm sure Mike can join in. And Robert, thank you for allowing us to share some of our research and our perspectives on this important topic. So one way I think to get started with that is to consider the very first paper that we published back in 2006, where we looked at two states, California and Pennsylvania, and focused on a period of time prior to the relaxation of that diagnostic criteria. So we were looking at data mostly from the 1972 to 1990 period, whereas the diagnostic criteria were relaxed in the early 1990s. And if you just look at the raw data in those two states, the autism rate quadrupled in the 1980s. So it doubled and doubled again in the 1980s. And again, that's before the relaxation of the diagnostic criteria. And in that paper, we estimate that about 20% of the increase in autism diagnoses in that 1972 to 1990 period were correlated with the advent and the growth of children's cable TV. So that would be consistent with a substantial percentage of the autism diagnoses being unrelated to the change in the diagnostic criteria and correlated with increased exposure to screen time. We have a couple of other papers that would estimate that a higher percentage of the autism cases are associated with increased screen time. But let me pause there, and Mike might want to elaborate on that or talk about the precipitation studies.
I'm happy for you to keep going, but we have a recent paper that has been published based on UK data, and there we're finding over a 15-year period that over half of the growth in autism diagnosis are correlated again with precipitation. So if you put all this together, I think conservatively, more than half. I think based on our studies, more than half of the growth is not due to the diagnostic criteria, but due to changes, some type of environmental triggers. Because the thing about our precipitation study in particular is precipitation is what economists refer to as an exogenous variable.
Yeah.
So the cause and effect can't be, you're always sort of worried about reverse causation. But when our variable that we're using to kind of study it is precipitation, that eliminates the reverse causation issue, because clearly, autism diagnoses are not causing precipitation. So those studies clearly suggest that there are environmental triggers. And it's also the case that it can't be the case that changes in diagnostic criteria are causing precipitation. So those studies in particular are very clearly suggest that environmental factors are important, and that one set of environmental factors are environmental factors correlated with precipitation. Obviously, screen viewing, and we have studies that sort of show a relationship between precipitation and early childhood television watching. So screen viewing is clearly a plausible hypothesis concerning what that potential trigger is.
I have to say the way you figured out these correlative connections was really brilliant, I thought, between, when cable TV comes in and the rainfall, because then when it's heavy rainfall, more time inside, and the little slide on Washington State. That's quite an amazing slide, actually, where you look at higher precipitation and higher autism rates in the western part of the state, if I remember, and then lower in the eastern part. So next question is a little bit of a devil's advocate question. I'm pretty sure that not all kids who are from age 0 to 3 getting a lot of screen time, let's say more than 4 hours, develop autism, right? So in other words, it's not a universal feature of too much screen time. Although on the other hand, I would say that undoubtedly it's a universal impact on children, because, as you know, the brain is just soaking up information from its environment at this time. So do you have any sense of why in some children with that much time it leads to these symptoms that get then diagnosed as virtual autism, and with other kids, are they sort of less socially interactive, or what's the sense here?
Can I take that one?
Yes, go ahead.
Yeah. So in our studies, we're always very careful to talk about genetically vulnerable children. So clearly, genes are important, and so we're not saying that by itself screen viewing is going to trigger it's screen viewing of a child who's genetically vulnerable. And let me make that sort of personal to myself, which is when my son got diagnosed as being on the spectrum, and I started reading about the condition, I realized I had grown up with kind of a mild version of Asperger's syndrome. And so my hypothesis was that, I was sort of slightly on the spectrum. My son was slightly on the spectrum. He was exposed to a trigger, and that made the condition much more severe. So again, I think all of us are saying this is true for genetically vulnerable children. That the problem is people don't know whether their child is genetically vulnerable or not.
Sure. And just one other question, though, that is raised by this. If I'm a parent and I see that this can be triggered, this extraordinary sort of, because spending too much time, your TVs all the time, that you're not adapting socially to the world in any sort of normal fashion. But maybe my kid is watching 2 hours a day. Now, the American Academy of Pediatrics says don't watch any for the first 2 years. Is there any sense, though, you're going to see social sort of delays, language delays, even if someone's watching in other words, is this sort of a canary in the coal mine for parents generally about how we raise our kids in those first 3 years? I know this is a little bit outside, but you can see why this film raises that question.
I'm happy to take that one too, if everybody wants. So there, even before we started doing research on this, there was already literature saying that screen viewing, particularly television viewing, can cause language delays. So that, to some extent, was kind of related to how I came up with the hypothesis in the first place.
Which, of course, then means it's a sort of a scary variable or scary thought for how we're raising our kids today, generally, I think.
Well, I think that's why the American Academy of Pediatrics says, don't do it for very young children and limit it afterwards.
Yeah. Now, here's one thing I was, you guys are, the researcher, and anybody can jump in on this. So you do the research, and I found it a very compelling story that, in fact, 4 hours or more, there's extensive things, and then the kid's not getting the normal social feedback and all can lead to the symptoms of autism. And including, by the way, I think we need to understand, into the severe category, right?
Right.
Okay. And then we heard anecdotal data about success. We heard people saying, oh, yeah, I did this with my child, and your son, the symptoms went away. And we heard this from other parents as well. What I didn't hear, and maybe there's not been any study, has there been a study that said, okay, we have now treated 50 people who we identify as having virtual autism, and then we put them on a no-screen diet, and what were their outcomes for all 50? In other words, do we have any outcome data that would look for all of those, treated, those sort of diagnosed with virtual autism and then treated with it? What sort of spectrum of outcomes do we have?
So I think the clearest data on that is from Romania. So Dr. Zamfir published an article. I don't remember Sean, do you remember what the year was? Well, anyway, it was probably late around 2018, 2019. He published an article based on the children in his clinic. And what he did was he divided the children, all diagnosed with autism. He divided them into two groups. One group had been watching 4 more hours. This is where the 4 more hours comes from. One group had been watching 4 more hours of screens prior to the diagnosis, and one group didn't. And then what he did was he had a treatment program which included no screens. And then he followed the two groups, and he found that the group of children who had been watching 4 more hours of screens, their improvement to the program was amazing, way better than you see in other studies, and in fact, way better than the improvement in the other group which hadn't been watching screens. So the plausible interpretation is that the group had been watching 4 more hours of screens. That was the trigger. And when the trigger was taken away and other, in combination with other aspects of treatment, the children did incredibly well.
So I think
I don't remember the exact numbers, but it wasn't just 2 or 3 students. It was a reasonably large number of children.
This is one of the. Thank you for that. And this is one of the things I wish that the message that this is why I think it's so important that the film is shown and this message can get out there, because it's a chance to reclaim the lives of many children. And Marilyn, you started about putting kids today under the illness or the neurological disorder model or whatever, putting them on antipsychotics. And antipsychotics actually, of course, limit social interaction. They limit curiosity. And they basically, over long term, they're pretty clear, they have some cognitive impairment over long term. So maybe to switch to you for a sense, Marilyn, and then we're going to talk about a little bit about why this hasn't been widely talked about and embraced in the United States. But Marilyn, what is your sense of loss, since you deal with families, that this hasn't been mainstreamed in the United States, and that you see kids being put on antipsychotics instead?
Why? What hasn't been mainstreamed?
the idea that maybe the cause is elicited from too much screen time, and what you
Oh,
need
I
to
see.
do is
Yes.
get rid of
Um,
the screen time.
right, right. Well, um, I the parents who come to me with children with autism or ADHD, they actually are very savvy about screen time. They don't allow it. They don't allow more than 1 hour a day. They allow no screens for children under 2, and then maybe half an hour of Sesame Street or Mr. Rogers. So I'm finding that parents are more and more becoming aware, not necessarily that screen time in early childhood is linked with autism, but it can be linked with all kinds of other problems, language delays, social communication. They want their kids, socially interacting at the playground with other kids rather than at the, front of the screen. But why it hasn't been accepted more generally, I think, is that because of the neurological, biological model of psychiatry. I mean, because psychiatry has been taken over by the theory that the mental illnesses are biologically caused by brain impairments, and they are lifelong disabilities, and they must be treated with drugs, or there's ABA, there's behavioral therapy, but basically it's something the child had from birth and will have for the rest of their life. It is, in short, the biological model of psychiatry, which you write so much about in Mad in America, that took over in the 60s and 70s, and now is the prevalent model of seeing all sorts of mental illnesses or neurological differences.
Just a month ago, I read a piece. It was related to Robert Kennedy Jr.'s idea that environmental toxins can be a cause of this. And the piece put that idea aside, saying that science had not found it to be so, that it was in fact a genetic illness and that sort of thing. But no mention of autism, virtual autism at all in that piece. It just was not mentioned as a possible, pathway to an autism spectrum diagnosis. And I thought it was rather remarkable that they didn't even address this possibility. So last question before we open this up, and either Sean or Michael or whoever wants to take it. Meg should be Sean or Michael. What has been the response to your work in getting it out there? Now, I know there's been a TV program about it, but within major research circles, you've been doing this for 20 years. What has been the response to your work? Has it been denounced, accepted? Just tell us the response and your thoughts about why it's generated such a response.
Ron, you want to start?
You should take it, Michael. You've been present from the creation.
So initially, we were vilified, right? So the medical community said we were crazy, and also we were kind of out of our lane, and we shouldn't be doing this. So if you go to the Wall Street Journal article, it's like, is an economist qualified to solve the problem, right? But then, in other countries, you see in Romania and France in particular, but also to some extent in Iran, you see research on this topic. And these people actually have reached out to me and Sean. And that's why, to some extent, we were able to, I think Wilder was able to kind of contact everybody to make a really great film. Because we had we knew who else was working on it. More recently, Karen Heffler and others have started doing research related to this. And so now if you look at the literature, you see a lot of papers that are consistent with this hypothesis. So the literature has changed. And I think that the doctors who say it's just a genetic condition and there's no environmental trigger, I think they're much less in the majority than was true 20 years ago and even 10 years ago. I think a lot of people now think that this might be important, but you're still getting a lot of resistance. I mean, that's kind of how science works. People are protective of the theories that they've been pushing kind of throughout their careers.
Well, I'll have to tell you, just by hosting this, I got some emails saying like, "What are you, a crank?"
There you
go. We've got a question in the Q&A, but I thought Zoe, if you could Karen Heffler come on, and so she can join the panel and answer any questions that come on. So if you can go ahead and invite her in, that would be fantastic. So here's just the first question that this comes from someone from Argentina. What kind of language impairments have been observed? And this is in the virtual autism, you know, kids you've observed. What are we talking about? What type of language impairments?
I'm not sure I completely understand the question. So in the case of my son, I mean, he basically lost language.
Stop speaking.
Well, he had was doing, he's he was very young, so was developing a vocabulary. I don't know, maybe he had 100 words, and then it was going down, so it was going backwards, and then then it got reversed after we turned off the screens. And I think that I don't know that people have sort of done studies which demonstrate that exactly, but there's certainly lots of studies kind of showing correlations between early childhood television viewing and lack of language development.
Yeah, I mean, I'm in the age right now where I'm a grandfather and now have six. And when you watch 1-year-olds and 2-year-olds and interact with them, I mean, they are just amazing sponges, right? Looking at you and like being curious. So you can see actually just when you're interacting with them how much they're driven to interact with you and to interact in a social manner, in a language diverse manner. So anyway, here's the second question. I've noticed a cultural shift lately where more and more young adults are identifying with the autism label. I'm curious if any of you are aware of any studied correlation between increased usage of social media, short-term real content, and virtual autism developing later, in essence. By the way, I just have to say, we hear this all the time. There are more and more youth identifying as autistic or on the spectrum disorder. And so if any of you can respond to that, and then I have a follow-up question to it, but can you respond to this?
Well, I'm sorry. I feel like I'm answering all the questions, but so I'm a little uncomfortable. But anyway, I will answer the question, which is I go back to my own experience when my son was diagnosed, right? I didn't identify as being on the spectrum after my son was diagnosed. And I looked at, oh, here's what the spectrum means. Then I realized that I'd grown up with mild Asperger's syndrome and maybe still had some traits, but very few. My wife would say none. But it's become much more publicized. So if it's become much more publicized, people are sort of looking, oh yeah, I have some of those traits. So it doesn't seem surprising to me that as it's become sort of more important in the general society, that some people realize that, yeah, they're sort of on the, mild Asperger syndrome, what's the term now? Functional autism end of the spectrum. Bill Gates tells me he's got autism. I don't think that really means very much, right? I don't think it's held him back very much.
No, well, no, I think that's one of the confusion. And first of all, I want to welcome Karen, who's joined us here on the panel. I think honestly, this is one of the societal confusions about it now. Because
I personally feel that it should, this is my own personal opinion. I feel like, mild Asperger's syndrome should not be referred to as autism, because I think it confuses, it makes people feel like autism is not a serious condition. And for people, there's a substantial proportion of the people diagnosed with autism where it's a very, very serious condition. And when Bill Gates comes out and says, well, I have autism too, it makes it sort of trivializes it, which I think is unfortunate.
Well, this is what I agree with, is the point. If you have so many people identifying who are actually very sociable and
Right.
good use of language, then maybe we're taking away attention to people who really, and including very young children, who do have these, language deficits and social deficits, et cetera. That said, you could be provocative in saying the whole society is becoming a bit more autistic because of the drop in vocabulary and social skills, but that's a whole another thing. Uh, Karen, before I ask the next question, do you have anything having listened to this, or you'd like to add to the discussion? Talk about your research a bit?
Sure. Can you hear me okay?
Yes.
Okay. Well, I think that there has been a lot of research around the world since the initial research done by Mike and Sean, and that things have changed a bit. So there is greater awareness and some acceptance that early screen time does significantly impact not only language development, but cognitive development, brain development, um, uh, having atypical sensory development, and that's some of our work. I'm at Drexel University, and our group of researchers looked at data from the National Children's Study, and that study was supposed to enroll about 100,000 children, but it was stopped prematurely. So the data that we had was unfortunately, somewhat limited, and it was already obtained data. So we could only look at the data that they had already derived. And at 1 year, they looked at data including, they had asked the parents, does your child watch TV or video? But it wasn't how many hours a day. But starting at 18 months, they did ask how many hours a day the children viewed video. And we were able to look at just over 2,000 children. And we found an association between screen time, again, whether the child watched or didn't watch, it wasn't hours a day, and increased autism-like symptoms, and this was on a screening test, so it wasn't a diagnosis of autism, and that study did not continue and did not have autism diagnosis in it. But we looked at it in a couple different ways. We looked at it was on a screening test called the MCHAT Revised, and in that there's a couple of ways of looking at it. One is looking at the total score, and then a derived yes or no, is the child at risk. So we found on the total score, so that would be an indication of the total symptoms that the children were having related to autism, that there was an association, but not on the derived autism risk score. And then other studies have shown and I believe Mike spoke about a study out of Japan that looked at over 80,000 children, and children who were viewing 2 to 4 hours, boys particularly, had an increase, and that was 2 to 4 hours per day, had an increased risk of developing autism by age 3 that was 3.5 times what it was for children that weren't viewing at all. So there are definitely, and then there's dozens of other articles, research that shows an association. But the studies that I mentioned are what we called they're prospective. So they follow children over time, and they look at the screen exposure at a very early age, and then what happened after. A lot of the studies are what we call cross-sectional. So at the same point in time, they're asking how much screen time does the child watch, and then autism symptoms, or does the child have an autism diagnosis? So studies like that cannot show any causation. Not that the prospective studies do cause causation, but at least it's that something that they had an exposure before something else happened. So it's going in that direction.
Yeah, I mean, I understand the correlation and causation debate all the time, and then this is wild, sort of a testament to you and your filmmaking capabilities. I found the film presented a very strong case for this. That in fact excessive screen time can cause behaviors, a decline in language, a lack of interaction that are seen as symptoms of autism. I thought you made a very strong case for that. I know it's correlative, but actually sort of a strong causative connection.
And if I can speak to that as well, so now there are researchers and clinicians around the world that are finding similar outcomes when very young children, and we did a pilot study at Drexel. It was also a small study in which children had an average of 5 hours of screen time per day. And these children were up to age 3.5. And when the screen time was removed, and we did this through educating the parents on how screens impact parent-child interactions, they disrupt, they replace, really important responsiveness and language related experiences that the children would normally have when they're on screens a lot of the day. They're not having those other experiences, but also because of the concern of the direct impact on brain development, that that screens can have a direct impact, and some studies have shown that as well. But our study did show that the children had over a 6-month period where we worked with the parents to give them strategies for engaging with their children throughout the day, including them in routines, strategies to get eye contact, to be responsive and recognize when their children were displaying some social behaviors, and they were which when the screens are on, parents don't recognize and then may not respond to them. And so over a 6-month period, when we worked with the families 1 hour a day, the autism symptoms did decrease significantly, and parent stress related to their child with autism also significantly decreased. And there's several other groups around the country, as was highlighted in the film, and now there's other ones as well, that are finding similar outcomes. And again, so now we have the association studies and the intervention studies. What we don't have, which we really need, is that if children are not exposed, does it reduce the likelihood that they will go on to develop autism symptoms? So sort of prevention studies are necessary.
Okay, thanks. We have a question I think is really, really important. It relates to how our society is organized, really. And it's from a physician. I'm not going to say her name, but I know her well. Most of my patients live in impoverished and marginalized communities. Do any of you have recommendations about how to support families who are already stressed by poverty and discrimination in eliminating screens when there may not be enough adults or older children available in the household to interact regularly with the younger children? I am interested in recommendations at the individual and structural levels. I think you can see the importance of this question, because what you're really saying is when children are in their first 3 years of life, they're probably even beyond, but particularly in the first 3 years, they need a lot of time with adults, others, aunts, uncles, brothers, sisters, play. But so many people well, the doctor put it terrifically. How about when you look in more impoverished communities that are just struggling to put food on the table, or maybe using the TV as a babysitter, what do you say to them? And again, she says, I'm interested in recommendations at the individual and structural levels. So, Marilyn, maybe you start, and anyone else can jump in after this. I think this is a very key question.
Yeah, I really do see virtual autism as something of a societal problem. For example, in France and other European countries, there's government subsidized early childhood daycare, quality daycare, in what they call the creche. And it depends on what you can pay. Lower income families could pay very little, and families with more income pay more. And it's high quality childcare in government subsidized, that is government subsidized. And the autism rate, I just took a look yesterday, in France is considered to be lower than 1 in 31. The numbers can vary depending on the study, but it's lower. So I think on a societal level, I really think that the we need to pay more attention to early childhood and providing help to mothers, especially in impoverished situations. I've come across that same problem before that the doctor raises. What do you say to a mother who can't afford a babysitter? I'm wishing that school programs, maybe preschool programs, would have teenagers or college students who could volunteer to be babysitting. I mean, something like that, a volunteer babysitting corps, AmeriCorps, something like that that could provide interaction for children. It's a tough problem.
I'm sorry. I'll just add that Lori Frome, who's one of our colleagues and is in the movie, and also is a therapist who's worked with some of the families in the movie. I think she has, first of all, she's very honest about how much time it takes the parents when they remove the screens in order to try to reverse some of the symptoms. So she's very candid about the investment that's required. But I do believe she also has some strategies that she could recommend. I think it's probably better for me to connect the interested viewer with Lori directly, so that Lori can share some of what she's learned. Karen, not to put you on the spot, but you may have picked up some of these strategies as well.
Well, what I would say is I think it's much more difficult for parents, particularly with limited resources, to have to try to have the type of support necessary when the child is already developing in the autism spectrum, rather than if they were informed before and that they could have limited the screen time if that was a factor in that particular child. Because once a child has already developed the autism symptoms, they're not really paying attention to people. So if early on more focus can be to having more time in the real world, so that the parents can have time with so the parents can have time to interact with their children, and develop some of those social recognition. So, for instance, understanding that faces are important, understanding that voices are important, that comes from parents responding and interacting with their children. Then children can learn from the environment, from the people in the room, because they're paying attention to them. But if their focus is highly audiovisual and they're looking at a flickering light or a fan that's spinning, and they're not paying attention when somebody walks in the room, it makes it much more difficult. So theoretically, if parents were given information from the very beginning, prenatally, that it's very important, that you're the most important person in your child's life, and your responses and being present is critical to them developing those early social abilities, that it requires much less resources on their part if their child's already paying attention to the things going on in the environment. Then the child can learn from the people in the room, from their peers, much more easily. Now, parents have, limited abilities in certain community, limited time. They may be working and trying to raise a baby and thinking that the baby could be, safe and growing if they're on the screens while the parent may be working. But if parents know that that's not really a great option for their child, and that their child may not be developing the social abilities that they need to be able to understand the world and interact, then perhaps they can change those early experiences. So, but I do think that that preschool and daycare that is available to everybody is critical, because the communities that can't afford daycare, then they're more at risk. And also communities where the parent education is lower and parent income is lower, they're more at risk to have the children be viewing more at a young age. So as a society, we need to have better options for families with limited resources so that they have abilities to have their children in the community and safe environments that's going to be prosperous for their development, to help them when they're trying to make a living or tied up with other things in their own family and can't provide that for their children.
But can I just add one little thing to
Yes.
what Karen was saying? So you want to be a little careful in terms of daycare or even babysitting, and make sure that you're choosing daycare and babysitting which doesn't put the child in front of the television or in front of screens. Because sometimes you'll hear stories where I had daycare, but the kid was in daycare, they were just watching screens.
Yeah.
You want to be
Can I just say one thing, and then I'm going to give the last word to Wilder here because we're about running out. I think this question was so important because as part of the biological model, we put the blame on difficulties in the individual, right? In the head of the individual, rather than in the social determinants of health. And now you have, through this film and your work, a problem with how we raise our children and the conditions in which people have to raise their children. You mentioned the lack of pre-K and that sort of thing in our country. How about the lack of parental leave right away? Other countries have parental leave.
Yes.
So as we talk about this, I hope this gets and I'm going to go back to your. I hope this film gets a lot of attention. I hope your research gets a lot of attention. But it really then needs to be like a societal response too. So you make a society that gives parents of all incomes the capacity to be more with their children, and because we should invest in the first years of every child's life is the point. And if you have a mother who's coming home and has to make dinner and put an older kid to, the TV is a nice thing to sort of maybe keep them quiet as a babysitter, et cetera. So I just think here as we talk about families getting rid of screen time, we do need this part of the discussion is how do we help families not have to rely on screen time? I think that's such a key part of this whole discussion. I'm going to go back to Wilder here. You did this film. You invested, I don't know, tell us how many years. We got a few minutes. What is your hope for, first of all, where's it been shown? Where are you going to show it? And what's your hopes for the film, Wilder?
Yeah, thank you. I feel like these discussions, that's what the whole goal of the film. And so we want to basically, this is the beginning of sharing the film with the world. We want to, we have two main approaches for our distribution, which I invite everyone to be a part of. So one will be showing at festivals internationally and conferences. There's a conference in October that will share parts of the film within Dr. Karen Helfler and Lori Fromm will be presenting there on early child development. Then we're also applying for a PBS broadcast for a 30-minute version that we have. And then our second approach will be more grassroots screenings, just like this one, online and in person. And those can be hosted with partner organizations. And then there's educational resources that the team has put together that can be incorporated into programs, and so that's kind of like the second phase as well. So if you're interested in hosting a screening, we would love to talk with you, and there's so much work that we could do to help raise awareness. And so this film is just a tool for all of the organizations out there that are doing this work around screen time and early child development, like student-centered learning. So yeah, we want to be of service. So I really look forward to it. If you have any questions, feel free to reach out to us, and we'll go from there.
So we'll go ahead and make if this is okay, your email available to people who've been in the chat?
Yes.
Okay, good. All right, I want to thank all those who came here today and for this, and I hope you all had who came here today that had a chance to see the film. Like Wilder said, I hope you can help promote the film. I think it's extraordinarily important. I think there's hardly anything more important than a society does than raise its children and help them become curious, you know, competent, thriving adults. And this rise in autism due to virtual autism is really quite a societal failure. That's what one of the things I got from this film. I hope you continue doing their research. For all those you came, thanks for your donations. Really appreciate you're here. We will make the recording available. If it's okay with you, Wilder, we'll even put this recording up on our front page on Mad in America, make it available to people. I don't know if you want to also make it possible for people to go ahead and see the film who haven't seen the film. You'll have to let us know. I wish you a great success with your film and wherever you have it, if you enter it into competitions, that sort of thing. Great if you can get it on PBS. And to the rest of our panel, thank you so much for your time, your efforts, and great discussion. I just want to emphasize from me personally, I think what you're doing is so, so, so very important. So thanks everyone for being here, and we'll let you all know about our next MIA webinar event. Thank you.
Thank you.
Here.